It happens more than 1.5 million times every year in this country. Someone suffers a traumatic brain injury, and that's exactly what happened to 18-year-old Lacey Adamson of Newton County. But what helped her might surprise you. The Fox Medical Team's Beth Galvin here now to talk about it.
And Sinead, we're talking about a really devastating brain injury that Lacey had. When she was airlifted to Grady Hospital, a whole team of specialists was waiting for her at the hospital's Level 1 Trauma Center. But Lacey's parents believe what saved their daughter was a $5 combination of vitamins and supplements. Lacey Adamson has always enjoyed kicking back with her guitar, but cheerleading she really loved.
I liked being able to yell and to yell at people.
And for her parents, Lori and Donnie Adamson,
there are no words.
Just being here with the only child they worked so hard to conceive and then almost lost feels like a gift.
She was a miracle when she was born, and she was a miracle on that day.
That day was July 10th, 2012. Lacey, 17, was driving back to Mansfield from cheerleading practice.
All I remember is heading home.
Her tire sort of left the road and hit a pothole, a huge pothole.
Lacey, wearing a seatbelt, swerved left and then right, flipping her pickup several times into a pasture as she was ejected.
The next thing I remember is the sound of the helicopter rotors.
My first prayer was, just don't take her. That was my first recollection that this is going to be bad.
And it was bad. Lacey was airlifted to the Grady Trauma Center, where Morehouse School of Medicine trauma surgeon Dr. Leslie Matthews was standing by.
The paramedics reported that she was seasoned, which is a bad, ominous sign.
CT scans of Lacey's brain showed it was swelling dangerously, covered with tiny lesions. They call this a diffuse axonal injury.
This is when the neurons are just sheared or just ripped, and the prognosis for this is very bad.
I've never been that terrified in my life.
And as the Grady trauma team worked to stabilize Lacey, Dr. Matthews began his own treatment.
We use vitamin D, omega-3 fatty acids, glutamine, and progesterone.
I remember thinking, vitamin D? Really? And fish oil? Okay.
But after years of research, Matthews is convinced that these supplements can help the brain heal. Lacey was given vitamin D and omega-3 fatty acids, two powerful natural anti-inflammatories to reduce her brain swelling, and the hormone progesterone and liquid glutamine, an amino acid to protect her damaged nerve cells. Every brain trauma patient coming into Grady receives these same supplements.
So basically giving the body what it needs to heal itself. The body, the way God designed the body is designed to heal itself if you give it the right nutrients.
I can't explain it. I don't have all the answers about it, but there is something to that therapy that absolutely works.
With Lacey, in 3 days, she began to wake up and follow simple commands.
Lacey had to relearn how to walk and talk and slowly recovered her memory. But 14 months after her accident, she is nearly fully recovered.
There's something to it. I mean, I have my child back. There's something to it.
And Lacey just started college at Georgia Perimeter, and she hopes to one day become a child life specialist at Children's Healthcare of Atlanta, and that's where her mom, Lori, works as an ER nurse. And Dr. Matthews believes that these supplements like vitamin D can not only help treat brain injuries, he believes they can help prevent them. And Tom and Sinead, he works with football players, high school football players, and gives them high doses of vitamin D to try to protect their brain should anything happen.
Wow, very interesting.
You know, you want something concrete done when your daughter's in trouble, but vitamins work, it turns out, this time, and those supplements that you talked about.
In addition to her other treatment, this seems to be what made the difference.
Amazing.
Wow. Beth, some people will be picking up some vitamin D. Thanks, Beth.